Welcome to yet another edition of COVID-19. I'm Min San-hee. Korea is fighting a new strain of the virus with its origin in the West. It is believed to be 6 times more infectious than the original strain that emerged in Wuhan. Meanwhile, the total number of infections in the U.S. has now hit above 3 million. For more on the latest figures, I have Kwon So-ah, and for more on related news, I have Kim Ji-yeon. Right then, So-ah, do start us off with the situation here in Korea.
All right. Well, usually there is a little concern that there's going to be an uptick in cases on Tuesdays because Monday's cases in many cases represent a smaller amount of tests conducted over the weekend. But we are down by 4 new cases this Tuesday. For a closer look, we have 44 new infections as of 12 a.m. That brings the total to 13,181. And the death toll stands at 285 as one more person lost his or her life in the past 24 hours. And 23 people less in quarantine, while 66 people made a full recovery from the virus, bringing the total to 11,914. And today's daily caseload is similar to that compared to last Tuesday, but we do see these surges to the 50s and even 60s. So it is good to see that we're now on a downward trend for the past 3 days. But what's not down compared to yesterday is the number of imported cases, as we again have 24 imported cases, which means today's figure outnumbers local infections. Now, while we have 13 cases here in Gyeonggi-do province, 6 of these were overseas transmissions, and the same goes for 1 case in Jeollabuk-do province as well as 1 in the city of Daegu. And we also have 16 imported cases that were detected through the airport screenings, while here 6 cases in Gwangju were all local transmissions. And with that, let's go over to our international updates. We have a total of 11.7 million cases now, as some 183,000 new cases were added, and that's been pretty much the average recently. We have 540,677 fatalities as of noon Korea time, as more than 3,900 people have lost their lives in the span of a day, and 6.6 million people have fully recovered. And meanwhile, the U.S. accounts for almost, or I should say more than a quarter of these total cases, as it has hit the 3 million mark with over 58,000 new cases. And also no slowdown seen in Brazil or India, with India having hit over 20,000 fatalities. Moving over to other places, Chile will soon hit the 300,000 mark. And also a concern is here in Iran, which now has 243,000 cases, surpassing Italy's total accumulated cases. And those are the domestic and international updates I have for now, but I'll be back here after the briefing. Back to you, Sunny.
All right, so thank you for that for now. I'll see you back at the desk later. Right, on the local front, the military here has played an important role in combating the outbreak in the country by supporting related efforts by the government and private sector while coming up with its own innovative testing methods. For more on these initiatives, I have our Defense Ministry correspondent Kim Ji-yeon here in the studio. Hello, Ji-yeon.
Hello.
Right, Ji-yeon, the South Korean military is known to have made strides in containing the spread of the virus. Tell us more.
That's right. The number of cases in the military remains at 0 since last Thursday, as the last remaining confirmed patient made a full recovery. There have been 58 confirmed cases in the military in total so far this year, the first one being reported on February 21st. This is the first time since 56 days that the military has reported 0 cases, signaling it's not an easy task to contain the virus's spread in the military. You may recall that there was quite a concern when the number of infections shot up nationwide following a cluster infection in early May. A series of testing for the virus was conducted after that, after a staff sergeant in the military cyber command had contracted the virus following a visit to clubs and bars in Itaewon, going against orders to refrain from such activities while off duty. A ban had been placed on soldiers going off base, taking leave, and having off-base visitors implemented from mid-February until April this year.
I see, Cheon. I hear there have also been some other innovative ways in which the military has helped to combat the virus.
Right. You have to understand that the military is very susceptible to the spread of the virus, so it wouldn't be a surprise that they would find innovative ways to contain the virus's spread. While following national protocol in disease prevention efforts, it has come up with its own methods and ways to combat the virus firsthand. Many people in South Korea had witnessed that the decontamination vehicles they've utilized, originally designed with a chemical or nuclear attack in mind, were deployed to help clean the streets. Currently, more than 500 troops are deployed nationwide to support disease prevention efforts. Meanwhile, after the outbreak stemming from the Itaewon-linked cluster infection that I've mentioned earlier, drive-thrus and testing booths have been installed in various military bases and buildings where confirmed patients had been. And earlier this year, Seoul's Defense Minister Chung Kyung-do had applauded some of the soldiers for their innovative ways in how they helped fight COVID-19 in the military. And these include the development of smartphone apps, test kits, and new diagnostic methods, including the sample pooling or batch testing method, I don't know if you've heard of it, which was first used by the military and then adopted by the Korea Centers for Disease Control in April. And the pooling method confirms test results more quickly by combining the collected samples instead of doing it individually, and is effective in diagnosing multiple people at the same time.
I see. Now, I also hear that how the military handles the epidemic has implications on its national defense. Is that right?
Yes. I've recently been to several seminars attended by Defense Ministry officials and experts in the field, and where they've assessed how the military has handled this epidemic. It was interesting to learn that those events, that they've categorized it as the spread of infectious diseases as a type of warfare that could shift the paradigm of defense postures. And along with large-scale natural disasters that are considered to be a threat, it's categorized as non-traditional security threat, to be exact, which doesn't involve weapons, but instances that could pose a grave threat in the country's defense posture if not properly handled. So that has led to various studies and analyses in understanding this type of threat to effectively devise ways for the military to better cope with a situation like these.
So has COVID-19 posed a direct threat to Korea's defense posture?
Well, yes, I believe so. It remains to be seen whether the South Korean and U.S. military are going to go ahead with their combined military exercise, which is scheduled in August annually because of the pandemic. You may recall that they've already postponed their combined computer-based simulation exercise earlier this March due to the pandemic. And just last week, the commander of U.S. forces Korea and Combined Forces Command General Robert Abrams emphasized the importance of the military's combined active combat training in maintaining readiness. And multiple South Korean military sources have told me that a further delay could affect the assessment of the South Korean military's full operational capability, which is a prerequisite for the transfer of wartime operational control from Washington to Seoul.
I see. All right, Jian, thank you for that report. That was quite informative. That was our Defense Ministry correspondent, Kim Ji-yeon. Thank you.
My pleasure.
Right, up next, we are poised to join the regular afternoon briefing on COVID-19 here in Korea. A new variant of the virus is spreading nationwide that reportedly has its origin in Europe and the US. According to officials here, it is 6 times more infectious than the original strain that was found in Wuhan. Now, this new variant belongs to the GH clade and is believed to have entered the country this spring. It was first registered in cases in early April in North Gyeongsang province and in cases linked to nightlife establishments in Seoul's Itaewon district in early May, and in cases linked to a Buddhist temple in Gwangju most recently. Also, in related news, more than 200 researchers from over 30 nations have called on the World Health Organization to acknowledge evidence that shows COVID-19 is an airborne disease. Now, observers believe such acknowledgement may lead to many countries rethinking their preventative measures. For instance, social distancing might require greater spacing between people, and buildings might have to change the airflow management. The acknowledgement is also expected to encourage a greater number of people to abide by calls for mask wearing as the most effective way of practically preventing themselves from possible infection while in the presence of people. And also in related news, that is, for those here in the country on the subject of face masks this summer, thinner, more breathable and thus less tight-fitting masks are now available at offline stores. Now, these offline stores would include pharmacies, supermarkets, convenience stores and even department stores as well. The prices range from about 500 to 800 won each. Here now is a briefing and we'll come back to you afterwards.
Let us now begin our regular briefing for COVID-19 response for July 7th, Tuesday. First of all, we have 20 new local infections today. And we also have 24 new imported cases, and the total number of confirmed cases now stands at 13,181. And 66 more people have been discharged following full recovery, while a total of 982 people are in quarantine. Unfortunately, we had one more fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. First of all, here are some updates on our domestic infections. At the Wangsong Church in Gwanak-gu District, Seoul City, we have found that one additional case was confirmed while in self-quarantine. In total, 37 cases have been confirmed to date. And in relation to an office space in Seoul's Gangnam-gu District, we also have found that in relation to the index case, we have one confirmed case and a total of 6 people being newly confirmed. And next, moving on to the Gyeonggi-do province, regarding a church member gathering in the city of Suwon, we also have found 5 additional cases being confirmed, and now the total stands at 25. And regarding an apartment complex at the Ujeongbu city in Gyeonggi-do province, we have one more person being confirmed, and in relation to this case, we have a total of 29 cases. And next, Gwangju City, at the Gwangnuksa Temple in Gwangju City, we have 5 additional cases being confirmed. In total, we have 92 cases being confirmed to date. And additional case, 2 of them were from the Gwangju Love Church, and also the 3 people were the people working at a sauna that the visitors of the Gwangju Love Church have visited. And the KCDC, we would also like to highlight the fact that at restaurants, there are high infectious risks because people cannot wear face masks while eating, and also they have a close distance. And our analysis shows that if there was a patient, for instance, if this person did not wear face masks, or it was put on very loosely, it was not tightly fit, and for instance, if this person engaged in conversations while taking off the face masks, and also one of the risk factors was staying in this place for a long time and engaging in conversations, thus increasing the travel of respiratory droplets, we have found that these were the cases where the infectious rates actually increased. And also at buffets, where there are the sharing of the utensils also increase the risks of infection. To this end, the KCDC would like to especially highlight some of the protocols that need to be complied by at the restaurants. First, please refrain from visiting these facilities when it's crowded, and please sit in zigzag formations. And also, please wash your hand and disinfect on a regular basis. And also, when you enter the place and before and eating, please wear your face masks, and please refrain from sharing the dishes and utensils, and use your own utensils. And also, when you are talking on the phone, please wear your face mask or go outside to talk on the phone. We tell you this multiple times, but while you are eating, because there are high rates of infection with respiratory droplets, please refrain from conversations. Even if you are are eating, please wear your face mask if you need to talk to each other. Next, here are some updates on the imported cases. We have a total of 24 new imported cases today, and 6 were from America, 1 from Europe, and 17 were from Asia. Among them, Kazakhstan accounted for 13 of them. Up until now, the imported cases have it now stands at 1,744. Meaning, and among them, 43% have been reported and spotted at the airport quarantine. And most of the others that have been spotted in the local community have been diagnosed within 3 days of entry into the country. And this is how the quarantine authorities were able to curb the further local spread of the virus from these imported cases. And out of the imported cases, we have had 10 people who were in critical conditions, and we have 1 fatality. And regarding the remdesivir, as for the drug for COVID-19, we have been administering this drug to about 22 patients nationwide, and the effects of the drug will be updated later when we have done the analysis. Up until now, in relation to the plasma therapy development, a total of 312 people have expressed intentions to donate their plasma samples, and a total of 132 people actually succeeded in donating their samples. Thank you very much once again for your participation. And last but not least, we would like to highlight the fact that we are seeing cluster infections continue to rise, especially centering around religious facilities and door-to-door sales facilities. Please take precautions for this. And in the press kit, we have included some analysis on the door-to-door sales. So these were the facilities that have held the seminars as well as large-scale promotional events, especially targeting senior citizens. And they also had clustered infections because they have had crowded gatherings in enclosed spaces that have been poorly ventilated. And therefore, we would like to ask the middle-aged as well as the elderly people to refrain from going to these direct sales seminars or promotional events going forward. Then in relation to the COVID-19, we have a few more announcements to make to the public. Right now, the vaccine for COVID-19, as for the development and as for the commercial use of these vaccines, and even determining the efficacy of these vaccines are not yet known. And nobody can be certain as for these efficacies of these possible vaccines. Nationwide and also globally, many of the renowned institutions and companies are exerting their full efforts to develop an effective vaccine. However, securing these effective vaccine and as well as making low temperature retail measures as well as supply of these vaccines to nations would also be very difficult in a limited time. And we believe that securing vaccine is also a very challenging task. And here in the Korea, we also have seen that cluster infections continue to being witnessed throughout the country, and we are not sure when this would end. And especially ahead of the summer holidays, we need to call ourselves to stay vigilant going forward. However, what's fortunate is that we have already have an effective vaccine against COVID-19. This is our knowledge and experience that we have learned as we combat the COVID-19 during the past 6 months. Of course, this is not perfect as of yet. However, these knowledge and know-how have become scientific evidences, and they have become effective vaccines to prevent ourselves from the infection. Of course, we do not have an effective therapeutics or vaccine. However, we have learned that our knowledge and experience have effectively helped us to curb the virus and helped us overcome the massive outbreak that took place in Daegu City. And according to latest research, there were also papers that say that the advent of new clades of the virus and new strains are coming into emergence. However, nonetheless, please remember that the principle of the quarantine does not change. As we told you so far, our knowledge and our experience have proved that keeping distance and washing our hands and wearing our face masks at all times in public spaces, even when we are talking and even while we are on the phone, are some of the effective measures. And also these include please staying home if you are feeling sick, and please contact the call center at 1339 if you have any symptoms. Individual practices of these quarantine protocols is the most effective vaccine that we have to date. Thank you very much.
네, 지금부터 기자님들 질의응답 시간 갖도록 하겠습니다.
Right, that was Kwon Jun-wook, the Vice Head of KCDC. With Tuesday's afternoon briefing, Soa, I see he's emphasized the presence of imported cases.
Yes, so let's start right there then, because we have imported cases in the 20s for 2 consecutive days. And today, just like yesterday, we had 24 new cases with 6 from the Americas, 1 from Europe, and 17 from Asia, and 13 were from Kazakhstan. So it is a concern that these imported cases are rising, but maybe not as much of concern, because all of these cases were either detected at the airport or during quarantine. So there is a low chance that these cases could become community spreads. Meanwhile, Kwon also mentioned some guidelines when you are at restaurants. For instance, you should try to refrain from going to crowded restaurants, wash your hands, disinfect your hands, and also try to wear your face masks whenever you're not eating, and also refrain from conversations. And if you're on the phone, you should go outside and not do that while you're eating. And he also had some calls on people, middle-aged and elderly people, to not go to seminars or promotional events linked to door-to-door businesses. And also some updates on treatments for the coronavirus. The remdesivir has been now administered to 22 patients here in Korea, but there needs to be a little bit of more research from the government before announcing the results of this treatment. And meanwhile, 312 people have so far expressed their intention to donate their blood plasma. This, of course, people who have been treated, who have recovered from the COVID-19 virus.
Well, that is good to hear. All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Right, a new normal has opened doors in the sports arena, as well as athletes and trainers alike adapt to virtual training sessions and other no-contact drills to stay fit and ahead of the competition. We have details in this report.
Online virtual classes are now in full swing amid the COVID-19 pandemic. The world of sports, where physical training is essential to keep athletes competing at an elite level, is also doing the best it can to adjust to this new reality. Featuring lights, cameras, and a green screen, one might think this is a television studio. But it is actually a gym and a lecture room, at least for today. Coach Chang In-ik is from the Korea Handball Federation, and he is giving a virtual lesson today, with students tuning in from their computers.
공격자가 오른잡이의 경우에 수비가 왼쪽 손과 다리가 나와야 합니다.
This is an annual leadership program run by the Korea Handball Federation. Up until last year, students gathered and trained together physically, but due to the COVID-19 pandemic, the entire program is now being offered virtually with the use of video training aids.
대면 훈련할 때는 지도자들과 소통을 하면서 이렇게 질문을 주고받는 형식으로 대면 강의에서는 할 수 있는데, 비대면 강의는 그냥 혼자서 라이브로 하기 때문에 그런 것이 좀 어려웠고, 동영상을 보면서 과연 이게 확실하게 전달될 수 있을는지가 좀 걱정스러운데 지금은 좀 어색하지만은 나중에 그 자료를 가지고 훈련에 활용할 수도 있으니까 좀 좋은 것 같습니다.
감독님 그쯤에서 공을 받아주시면 돼요. 기현 매니저가 저쪽에 던질 거거든요.
The instructors not only provide taped lectures, but also overlay CGs on top of the videos to create a lively training aid.
프로그램을 제가 지금 작년에 같이 받았는데 올해도 지금 다양한 프로그램을 좀 배우고자 하는 그런 마음으로 좀 신청을 하려고 했었는데 취소될까라는 걱정도 했었어요, 코로나 때문에. 근데 지금 현재 이제 온라인이라는 강의로 인해서 학생들한테 지도하는 데 굉장히 큰 도움이 될 것 같고요.
This video training course will be provided to 43 countries across Asia with subtitles in English, Arabic, and other languages in order to train future leaders in the sport of handball.
지금 처음 하기 때문에 부족한 게 많겠지만은 앞으로 뭐 비대면 수업이 많으면은 내년부터도 또 뭐 비대면 수업을 할 수 있는 상황이기 때문에 좀 더 발전해서 할 수 있지 않을까 생각합니다.
K 핸드볼 교육이고 이것이 그 아시아 핸드볼 교육의 이제 롤 모델을 지향하는 부분 그런 것들이 큰 의미가 있다고 생각이 됩니다. 그 언택트 시대에 가장 적합한 교육으로 그 국내 그 스포츠계 지도자 교육뿐만이 아니라 아시아에서도 롤 모델이 될 수 있는 그런 의미가 있다고 생각이 듭니다.
Amid the pandemic, another simple preventative measure to keep safe is to limit unnecessary physical contact with people. Thus, the popularity of non-face-to-face interactions in society today. Yet some believe that the no-contact trend may affect our psychological well-being. For more on this double-edged sword, so to speak, I have Professor Seo Soo-yeon from Seongshin Women's University. Welcome, Professor Seo.
Thank you.
And I also have Dr. Won Eun-soo from Cha-eum Center. Welcome back.
Hello.
Right, Professor Seo, let's begin with your thoughts on the merits and setbacks of online classes.
Well, we've definitely been having an unprecedented semester, and I think the upsides of going to online learning is that the students it's safe for the students and it's convenient, but there's definitely been some disadvantages. For one, I think really it's missing the aspect of social learning. A lot of the times when students learn, it's through an interaction. We have discussions, we interact, and it helps motivate the students to do better. And there's also team projects that the students are engaged in, and it helps them facilitate relationships with their peers, and I think that's really been missing. I think another piece is that with online learning, there's really a lower standard in terms of how diligent they're working, and also morality in terms of the way they take the test. So we've had more incidents of cheating, and so I think we definitely are faced with the challenge of trying to increase morality in the cyberspace that we now call a classroom.
Right. Dr. Won, the interaction between a patient and a doctor can also take place virtually, as in the form of telemedicine, for instance. What are the positive and perhaps the negative aspects of this non-face-to-face medical approach?
Sure. Remote medical services in Korea were only allowed between physicians starting from 2002, but due to COVID-19, teleconsulting, telemedicine has been allowed temporarily for these past few months. The beneficial aspects are easier access to treatment, especially if you're someone in an area without many medical facilities. Also, remote medical services are considered to vitalize in the future the medical industry and all industries associated. However, physicians are concerned about how accurately they would be able to assess patients through remote medical services. Medical examinations are not just done by visual and vision and hearing, but also tactile and olfactory sensations as well. And many times basic blood tests and imaging tests are needed as well. So many are concerned that an exact medical evaluation that leads to sufficient diagnosis and treatment is not possible with the current technology on remote medical services. Also, it's easier to teleconsult a previous patient that you've already been treating for a chronic illness and you have sufficient medical knowledge about. But many physicians find it difficult to assess new patients through remote medical services. The Korean Medical Association and the Korean Hospital Association have opposite views on this point right now. The Korean Medical Association is strongly voicing opposing views on telemedicine, emphasizing the lack of safety and the possible legal issues that may arise, and the need to build a healthcare system that fully encompasses remote medical services before it's actually implemented. But the Korean Hospital Association, on the other hand, has proposed certain principles that must be kept if you were to provide medical services remotely, such as new patients should be examined only in person, and also medical illnesses that can be treated through remote services should be carefully pre-selected, and the phenomenon of patients leaning too much to a certain type of hospital, such as university hospitals, that should be prevented.
Right. Now, we've just heard about the impact of non-face-to-face interactions in the medical and academic arenas, but what about the impact of this trend on our society and people in general? Now, to answer this question, I have Professor Richard Carpiano at the University of California, Riverside, live on the line. Welcome, Professor Carpiano.
Much for having me.
Professor, would you agree that the society's tendency toward non-face-to-face interaction had been taking root way before the pandemic?
Well, certainly. I mean, we're definitely social beings as humans, but so much of our social life and our interactions have been increasingly involving non-face-to-face mediums, whether it be email, texting, social media, networking sites, even online shopping and virtual meeting platforms. But the COVID-19 situation has certainly sped up the process in just a few weeks' time, and it's forced us to really recognize how prominent and really valuable this type of 21st century communication is in our daily lives. For so many things that we do, whether it be work or school or just even maintaining friendships or ties in a community. So it's really difficult to imagine how our lives would have functioned without them, sort of in the midst of what we've been facing.
Professor, how is the culture of no physical contact unfolding in the U.S. then?
Well, there is lots to be said about the American reputation for individualism. In general, and what polls have been showing is that generally activities that have required us not engaging face-to-face have been generally embraced in terms of social distancing, and even if one wants to consider sort of mask wearing too as sort of part of that as well. Unfortunately, that type of support has not been universal and has not been sort of evenly spread throughout the United States, and that's certainly presented some challenges when we've seen lots of pushback against different sorts of measures like mask wearing, for example, and definitely a push for things where people want to engage very face-to-face in activities, whether it be at a bar or a restaurant or even a gym, for example. And so that's certainly presented challenges from a public health standpoint in terms of trying to fight transmission.
Despite its convenience, non-face-to-face interactions are also seen to disrupt our emotional connection to those around us. What are your thoughts on this concern?
Well, there is one thing that is unfortunately a bit lost sometimes with non-face-to-face interaction, and that is the randomness of our lives. If we think about walking down the street, or just in terms of just our everyday sorts of routines, and about strangers or just random encounters that we might have in terms of socializing with an individual, that's unfortunately a bit lost with more and more of a move towards online types of communication, where usually our types of interaction are much more planned out and scheduled. Versus these sorts of random opportunities to interact, say, with our neighbors or with family or make a new friend even. And so that is a sad, unfortunate part of the current situation that we're in. But again, to what extent this might be sort of the new normal, or whether this might just be a period that we're going through of a particular intensity of this type of interaction, time is going to have to tell, and we will have to see within the next year or two, and if and hopefully when we have a vaccine and we're sort of past this COVID period.
Right, I'll keep my fingers crossed. All right, Professor Carpiano, thank you very much for your thoughts and for making the time to join us live at this hour.
Thank you very much for having me.
Right, Professor, so for those who find interactions with strangers intimidating, this non-face-to-face alternatives provide them with much relief. There is also belief that a growing number of students are more comfortable interacting virtually than physically. What are your thoughts on this?
Well, even before COVID, we did see an increase in people in younger generations kind of avoiding social interaction and preferring to be alone. But I think there's something to be said about social skills. Social skills are something that needs to be cultivated through social interaction, and usually they're honed through social interaction as well. Understanding and communicating with each other, learning the nuances of facial expressions, understanding what other people are feeling. All these things are kind of within the realm of learning social skills. And I think with the lack of social interaction that we continue to have with COVID, I think one of the things that happens is that we see a lot of difficulty with dealing with other people and communicating with other people. And I think in the future we'll see a lot more difficulty with this generation who are dealing with this right now.
Right. Now, aside from appearance-wise, it might sound negative, but then I'm sure there are some benefits of no contact trends. What, from a medical point of view, might be some of the benefits of non-face-to-face interactions?
Especially at home, I think it's beneficial because if we stay at home more, we are bound to communicate more with our family members. And it's surprising how little amount of communication is actually being held in the household. When I hear my patients, and not just my patients, but the people I know in general, it's surprising how little conversations had been made at home. And without communicating, we can't really know what the other person is thinking and feeling, and really understand and empathize and connect with someone is to make conversation. We can't know any other way. And I've seen couples and children and parents talking about the same situation but having completely opposite views, and so many misunderstandings between the family members as well. But we're so busy with work and school, etc., we never have enough time to have this deep communication at home. So with the stay-at-home lifestyle, due to the COVID-19, people were being forced to stay at home, but that led to spending more time with family members and having that communication.
Right, so they're talking more then. Right, Professor, so what are the psychological effects then of a prolonged period of no contact with other people?
I'm sure a lot of people are kind of sick and tired of the situation right now. I think what we're really experiencing is kind of a halt to external experiences, and it really gives us an opportunity to look within ourselves and face some of the problems or face some of the issues that we might have had. And for some people, I think it can be a positive experience, kind of putting a pause to their life and really realigning their values. But I think for a lot of people who already had these mental issues to start off with, I think it could amplify some mental health issues. I think the biggest thing we're seeing right now is an increase in loneliness. I think loneliness was already a pretty big public health concern before COVID-19, but a lot of people really were reluctant to talk about it. But now there's a very good reason to talk about it. And there's a good research that shows that if you're lonely, it's equivalent to smoking 15 cigarettes a day. It's definitely very detrimental to your health as well. And so if you think about it, the kind of repercussions that things like loneliness or anxiety have on our mental and physical health, I think there definitely needs to be more discussion about how to address these things.
And the pandemic appears to have brought these issues to the forefront.
Absolutely, yes.
Right. Dr. Won, people complain of addiction to mobile phones and online games amid the pandemic, of course, as well as the inability to perhaps perceptively communicate with those around them. What might be some ways to address these problems?
Right. The ability to socially interact is related to something called theory of mind, which is the ability to attribute mental states such as emotions and knowledge to others. And it's crucial for social interaction. Empathy is a concept that's related. It's understanding the other person's emotions. It's really putting yourself in another person's shoes. And previous imaging studies have reported this theory of mind ability to be related to certain brain areas. And especially in adolescence, theory of mind develops continuously to late adolescence. It's because their brain connections are still developing. And in particular, the prefrontal cortex, which is like the frontal part of your brain, is most involved. But deficits in theory of mind abilities have been shown in people with addictions with substances such as alcohol. And scientists have also warned that video games, they all only concentrate the brain on vision and movements. And that's why brain areas such as emotions and learning, they cannot be stimulated. And smartphone addiction is also considered to be a compulsive behavior, such as substance addiction. So I think among those who have symptoms of smartphone and online game addictions, they're complaining of theory of mind abilities to be negatively influenced, such as rusty social interactions. So some basic self-treatment methods of smartphone addiction involves make rules for yourself concerning your phone usage, set time periods you shouldn't use your phone. And also there are applications that help you cut down on your smartphone, so download them if they're helpful. And relaxation techniques such as mindfulness, they really do help for the cravings of your smartphone usage or social media usage. And if these methods don't help, it may be possible to consider meeting a professional for it as well.
Right. Professor Seo, how can we better prepare ourselves psychologically for the changing times, so to speak?
Well, while the COVID-19 has posed serious challenges to us, there's definitely room for growth, and it's possible to emerge from adversity. So I propose three things. I think the first one is that we should grieve the old normal. You know, there definitely is some anger and depression that can surround it, and we really need to process those emotions, focusing on things that you can control and can't control. The second one is finding new ways to connect with people. Just because you're socially distancing doesn't mean that you have to isolate yourself socially. So, you know, using technology, making sure you're checking in with loved ones, I think is important. And the third one is really thinking about creating a new routine. For example, if you used to go to the gym, you know, I don't go to the gym that much, but now I go hiking with my son because, you know, I can't go to the gym regularly. Or, you know, if you used to make a regular run to Starbucks in the morning, which I used to do, you know, trying to make coffee for yourself in the morning and making new routines so that you can still maintain that pleasure in your life, but also adapt to the new normal.
Right. What, Dr. Won, would be your words of advice as a psychiatrist to keep our mental health in light of the pandemic?
Okay. Well, I think Professor Seo has mentioned all the important parts, so I'm going to make it short. I think to accept that some inevitable changes have to be made and to adjust my lifestyle to these changes, it's important. To only concentrate on the downsides of what's happening, it's only going to make you unhappier. So let's try to focus on the bright side.
To change your mindset then. Is that what you've been trying to do as well?
Yes, definitely.
All right. Well, thank you very much, Dr. Won, for your thoughts, and Professor Seo, thank you very much for being with us today.
Thank you for having me.
And on that note, we end Tuesday's edition of COVID-19. Do join us again tomorrow at this hour as we delve into the fastest speed of the infection in recent days and the possibility of airborne transmission of the pandemic. In the meantime, do reach out to us with your thoughts and inquiries via our social media accounts or homepage arirang.com. Thank you for watching.